Winter in Canada is when viruses see the most spread, and this year is no different. From Norfolk to the flu and COVID-19, there are many viruses impacting families across the country. To give us some perspective, we are joined now by Dr. Kwadwo Kyeremanteng. Thanks for being here today.
Thanks for having me. I'm Manuel.
Okay, doctor, you see the worst cases in the ICU, but what is the state of our hospital system right now?
I mean, as you can imagine, Mandalina, with it being in the winter season, the respiratory bugs are definitely circulating. We're seeing a lot of gastroenteritis amongst our kids. But luckily, at least in the city I'm in Ottawa, we're not being overrun with some of these ailments, but certainly we're seeing higher incidences that we were seeing a couple months ago.
And we hear a lot of situations where hospitals are at capacity. Have you seen that this winter, or are you seeing it?
Yeah, it is true. Like we do get busy swings, and a lot of that is stemming from, as we can imagine, it being a respiratory season, seeing a lot of influenza, and sometimes the influenza turns into bacterial infections in terms of pneumonia. So, especially in our elderly population, we do see more patients coming in with this. But as we have been for many years, we are resilient. We are the healthcare providers doing our best to accommodate the high demands, but certainly this time of year, demands are high.
So if you do have one of these viruses, how do you know when it's time to go to the hospital? What is the guidance for different age ranges?
That's a very good question. So, for example, a lot of people in the daycare or young school age are going through Norwalk or some form of gastroenteritis. And what you're looking for there is really how hydrated the kids are able to be. So if you're showing signs that the kid is lethargic, their eyes are sunken in, they're not as interactive as they would be, that might be a time to help to seek out a healthcare provider to assess their hydration status and maybe need IV fluids so that they can make sure that they get enough fluids to their organs and allow them to thrive again. And then when it comes to the respiratory bugs, especially in our elderly population, what you're looking for is significant shortness of breath, significant lethargy, like their energy is not there. Sometimes they might be feeling drowsy or showing signs that their pressure is low. And if those are signs and symptoms that we're seeing, certainly you want to be in the hospital sooner than later.
Okay, well, let's talk about how we can stay away from these illnesses. The advice is to wash your hands and keep them away from our faces. But when you're in close quarters like office spaces, schools, even movie theaters, newsrooms, how can we stay healthy?
That's a great question. As you mentioned, there's the common hygiene that you want to wash your hands, avoid touching your face, as you mentioned. But probably one of the more underrated things is taking good care of yourself. You know, like making sure you are sleeping well and reducing your stress, especially this time of year when we're hunkered down at home at times, not doing all many of the things that kind of can relieve that stress. But making sure you're sleeping well, moving and getting outside despite the weather, and eating well, having a well balanced diet. My bias is always focus on protein, but yeah, I think taking care of yourself is one of the things that's most important. If you're feeling signs and symptoms of a cold, or obviously you want to stay home or wear a mask if you're surrounded by in an area that's surrounded by many people. But I think it's underrated, Madalena, that we should try and take a better care of ourselves, especially during these winter months.
I like that you mentioned moving and getting outside. I have heard that quite a bit. So is that a thing? Go for a walk outside in the winter to avoid getting sick?
Yeah, I mean, there's one of the common myths is like if you get a cold exposure, you're more likely to get a cold. But it's it's about being holistic and well-rounded. I just feel like when many of us are our best selves, and that means sleeping well, eating well, and staying active, we're less likely to get sick. And during those winter months, yes, it's tough to get outside at times, but when you get that fresh air, you get that sunlight first thing in the morning, you're sleeping better, your mood is better, your stress hormones are less active. So to me, it's maybe not the most common thing you hear from my ICU doc, but I encourage folks to stay active and have that holistic approach.
No, I like it. Noted. I will take more winter walks. That's great advice. Now, beyond the ICU, you also dedicate some of your time to a podcast called Solving Healthcare. It focuses on improving healthcare delivery in Canada. What do you think needs to change?
Oh my goodness. So thank you for this question. I would love us to two major things. One is a more focus on prevention. And as an ICU doc that saw a lot of patients during the pandemic, it was there was a lot of people that we were seeing, unfortunately, that had, type 2 diabetes, obesity, hypertension. And my big mission is to try and get people active again and get healthier again and have that level of agency and for us to invest in prevention. To me, this is a huge area that I think Canadians are ready for, to really focus on how collectively we could get healthy. That's number one. And number two is getting better access to primary care. In my city, about 20% of people don't have family docs, and that can unfortunately overrun the healthcare system in terms of wait times in emerge and so forth. And I think there's solutions there, Mandalina. Like, for example, we we don't often think about this idea that family docs or any medical trainee can work in any province. Like right now, if I wanted to help out in British Columbia, I would need about 6 to 8 weeks to get my license. Whereas I can promise you I can handle taking care of patients in BC. So why do we have provincial licensure? It should be national licensure so we can meet the needs of Canadians where they need it. So yeah, prevention would be a big one for me, and also access to primary care would be so important.
Wow, so an interprovincial medical system might be helpful. That's interesting. I didn't know that.
Yeah, no, I think there's a lot of solutions there, Mandalina. I just think it's time for us to be willing to think outside the box and meet the needs of Canadians right now, because I think there's a lot of concerns at this time.
Absolutely. Well, doctor, we thank you for your time today. That's the head of the critical care department for the Ottawa Hospital, Dr. Kwadwo Kyeremanteng.